Welcome to Conversations on Healthcare. This week we welcome Project Hope's CEO Rabih Torbay and Emergency Preparedness Director Tom Cotter on the ground in Romania, providing medical support for refugees and those impacted by the war in Ukraine. Now, here are your hosts Mark Masselli and Margaret Flinter.
As the war in Ukraine escalates before our eyes, so does the scope of the unfolding humanitarian crisis. Millions of refugees are fleeing into neighboring countries while aid agencies are flocking into the region. One such agency is Project Hope, which has brought aid to disaster areas for more than 60 years. Today, we're joined by its president and CEO, Rabih Torbay, from their headquarters in Washington, D.C.
And also by Tom Cotter, Project Hope's Director of Emergency Response and Preparedness. Mr. Cotter is joining us from Bucharest, Romania, where he's overseeing the effort to provide desperately needed medical and humanitarian assistance on the ground. Gentlemen, we welcome you to Conversations on Healthcare.
Rabih and Tom, this war is unfolding in real time for the whole world to see, and the images are devastating. Bombed children's hospitals and maternity wards, entire cities being leveled, and millions of desperate refugees flooding into neighboring countries. Let's just take a moment and look at what your team is witnessing on the ground.
I was here a week ago, and it was, I would say it was quite empty. People would usually stop for a hot soup, a hot beverage, to take some rest, and they would continue their journey towards Poland. I think the majority of the people that are settled here are Ukrainians. It's much more full than it used to be like a week ago. It seems that not everyone has a bed.
Wow, just so much to take in. Rabih, let's start with you. Project Hope has been delivering medical assistance and humanitarian aid in war zones and disaster areas for decades, but the magnitude of this crisis is being called unprecedented in the war zone and in the mass exodus of refugees. What are your gravest humanitarian concerns as this war escalates?
Well, Mark, as you mentioned, this is something that we haven't seen yet, not in the recent history. We're talking over 1.5 million that have crossed within 2 weeks, in addition to probably millions of internally displaced inside Ukraine. We're talking about women and children who are fleeing the conflict. Those are vulnerable people that are fleeing the conflict, leaving everything behind. The separation of the families is something that is of concern as well. But also, in addition to that, the health of people that are left behind with hardly any medicines or medical supplies, in addition to those that are fleeing, it's something that is of great concern. And we're talking about both physical health as well as mental health. This is something that we're looking at. This is something of great concern. This is something that we'll have to deal with for a long time.
Tom, you're in Romania, and that's one of several countries that have responded to take in upwards of 3 million refugees so far. More people to come, and as we've just noted, suffering from hunger, from illness, and trauma. And I wonder, what kind of infrastructure do you have, or are you trying to establish to meet this overwhelming need, both for the physical conditions, but also for the level of emotional and mental trauma that people are suffering?
This is, as Rabih said, this is a crisis that's relatively unprecedented in near history. So a lot of the systems that are absorbing the refugees are being built as they're being run. This is, we like to say this is building the airplane while it's flying in the sky. And the systems will continue to improve. Right now, the host countries are doing a lot in terms of making sure that refugees have access to existing healthcare infrastructure that the normal populations of the host countries have, as well as making sure that incoming refugees are being screened for vaccines, including, let's not forget, we're still very much in the middle of a pandemic in various stages. And that's still a looming threat to make sure that countries like Romania, which have been doing quite well on their COVID-19 outbreaks, don't experience a surge. And on the mental health side, this is a particularly difficult challenge, I think, for host countries, especially with linguistic and cultural differences. Mental health is very much reliant on what I call the crucible of culture. There's no getting around it. If you are seeking mental health care, if you're trying to help someone through a crisis, you need to really be able to connect with them at a very human level. critical. And those of us who've worked in the field really understand that. With language difficulties, with language challenges and folks not speaking language fluently, that can be a challenge. So, the ways around this are finding local resources and engaging refugees themselves who are able to be hired and can work within this infrastructure to help it adjust and surge to meet the needs of people coming.
Rabih, I want to pull the thread on Tom's response there. I don't think many of us would have an idea of how to approach this. And yet Project Hope has a no regret approach to diving headlong into crisis. You say there's a critical window when lives are at stake and the impact can be the greatest. So you jump into the fire, you adapt to as you go. Tell us about that approach and how it's been formed.
Yeah, Mark, that's a great question. And it's something that we debate all the time internally. In medicine and especially for emergency responders, there's something called the golden hour. When an accident happens, you need to go in immediately. That's your golden hour to save the patient. And we're looking at it the same way. We need to go in when the needs are the highest, even though there are a lot of unknowns. I mean, we're going into a situation knowing what we know, but we know there are a lot of things that we do not know much about. But we go in taking a risk, taking a chance, knowing that we're going to learn on the way. And it's proven to be very effective. I mean, we got on the ground in Ukraine as well as Romania, Moldova, and Poland in no time. And we started providing medicines, medical supplies, sending the teams in to assess the needs and addressing it. And as Tom mentioned, one thing that is really critical as well is the culture. Being culturally appropriate in terms of what we do, learning what works and what doesn't work in every different culture, and adapting is something that we do very well, and it's critical.
Well, Tom, I know that an important element of what you're doing is coordinating with the other aid agencies that are on site. We've seen Doctors Without Borders, UNICEF, the International Red Cross, the World Food Program, and I'm sure there are others that we haven't mentioned. You've got a particular in Project Hope focus on supporting the medical infrastructure, but how are you coordinating? What's the kind of infrastructure? I'm sure you've played this out in other areas of response before, this coordination of your unique contributions. How is that going? Maybe tell us a little bit about that.
Well, it is a bit different in every disaster. And I think the scale and scope of this are really pushing the limits of how we approach the actual management of a response of this scale. This is 4 or 5 countries. And then if you look at refugees that are coming and then moving on towards other places in Western Europe, the scale is really hard to even define at this point, this early on. So coordinating is really important. It happens at a local level, it happens at a national level, and it happens at an international level. And making sure that we're tapped into existing infrastructure, I think that's really important. We don't want to take a system and create a parallel siloed system to something that already exists. As I mentioned before, part of what we're doing is helping host governments surge to meet the needs. It's not creating new clinics. It's not building our own psychological hospitals. It's what can we do to support what already exists so that it can meet the needs. And we do that with the host government. We do that with local partners. Again, as we said, the culture is really important. And who best to address the needs of people but people who share their culture. So any way that we can find local partners that then we can support and partner with and help them scale, that's the best way, we think to do a lot of our work. And it is a challenge. I mean, it's harder than you might expect, and it gets better with time. This is going to be a very long crisis. And so finding ways to, get everyone at the table and making sure that there are no gaps and there's no overlap as well. We don't want to waste resources. So partnering, a health NGO like Project Hope, that does health, we want to work with food NGO, child protection NGO, a water NGO, and making sure that we're providing comprehensive care and nobody's left behind.
Rabih, I'm interested in how you build this supply chain for a situation like this. And we've seen with pandemics, supply chains get disrupted. And I wonder if you could just walk us through the process from the United States over to Ukraine and to the other points of how this gets set up. It was easy, anybody could do it, but it's not. It's a very complicated and demanding process that you've developed?
I mean, supply chain is one of the most critical aspects of any response, right? We can send doctors, we can send nurses, we can send experts, but if we don't have medicines and medical supplies that go with them, there's really not much they could provide in terms of treating a patient. And we have developed a very robust supply chain. First of all, I mean, donors in the US, people in the US are some of the most generous people in the world. Anytime there's an emergency, they reach out wanting to support, whether by donating resources, funds, or supplies, medicines, medical supplies, and equipment. And we have different partnerships with companies, with organizations, with corporations that always reach out to us and donate some of their supplies. But also we do some procurement as well in the US and Europe. And as you said, in any emergency, the supply chain becomes it could become a bottleneck, first of all, because a lot of supplies are going into the region and airports and ports have limited capacity, but also the demand is high. And sometimes the supply chain is not there to meet that demand. So we tend to diversify in terms of where we get some of those medicines and medical supplies. We get them in wherever we can, as long as they're the quality that we want and they have the expiration, the long expiration date that we need. And we send them by air, by freight, whatever we can, by sea freight, whatever we can to the ports. We're relying heavily now on buying in Europe as well. Because of the proximity, we can get them in sooner. But also, we have a lot of flights that are going in with medicines and medical supplies from the US. And it's something that we manage very closely. We have a team of expert logisticians, both at headquarters and in the field. And they're the ones that actually, handle the cargo from the minute it's given to us all the way to the delivery point to Tom and his colleagues as well.
Well, Tom, I'd like to talk about the millions of refugees who we have seen leave Ukraine and go into other countries. And at the same time, the whole world has been moved by the way people in these countries have opened their homes, their hearts, to bring people into their homes, and probably not for a few days, but probably for more significant stays. And I wonder, and I don't know if this is outside the scope of what you do, but preparing people who are bringing individuals into their homes who've been traumatized, who may have medical and health needs. How are you working with people on the ground to prepare them, maybe provide them some additional training and support to help the people to whom they've opened their homes?
It's a big, it's an astonishing thing to watch. The outpouring of love and care from communities in literally throwing open their doors and receiving people. It's I've never seen anything like it in my career to this scale, and it's really encouraging, and it really does matter. It's making a big difference in integrating people fleeing violence into new communities. But as you said, there are some considerations that need to be, forefront of mind. One of which is folks coming with specific needs. You mentioned mental health needs. It's a very delicate thing to receive someone and interact with somebody who's experienced such acute trauma at their own home. And there's a tool called psychological first aid that allows any layperson who's not a psychologist or a psychiatrist to essentially validate those feelings that a person might have fleeing violence, and allows you to help them return. Now, most people, by and large, are not going to need any additional support other than some sort of normalcy. We find this in most disasters. It's not that everyone needs to see a psychiatrist or psychologist. It's a very low level acuity of care, I'll say, and these trainings can help. So right now, Project Hope is actually working with, as I say, local partners in Romania to provide that training for psychological first aid for volunteers working at the border, the people handing out the toys and the food and the water at the border, and also the people who are receiving refugees in their home. The other thing that's really important for folks that are receiving refugees is helping them navigate the healthcare system. So making sure that there was a case where someone who had cancer showed up in a Romanian person's home who had thrown up their doors, and they need to help them get appropriate care in the healthcare system in the neighborhoods they're in.
Well, Tom, we have to sort of acknowledge, obviously, both the bravery that's happening with the Ukrainian people, but the compassion that's happening in all those frontline states of families doing such important work. And Rabih, I want to talk a little bit about the scenario planning that you're doing. Obviously, we just witnessed an attack close to the Polish border. I'm wondering how you're thinking about it, almost analogous to sort of the military planning. You must be kind of contemplating what happens if there's other scenarios happening. What's that team look like, and what do you see as next in terms of how you prepare for what we hope won't be an expanding war, but accidents do happen. What's your thoughts there?
Yeah, I mean, let's hope accidents don't happen, and let's hope there is no expansion to this war, and let's hope that this war ends soon, because even if the war ends today, our work will be there for a long, long time in terms of rebuilding the healthcare system. But you're right on point, Mark. I mean, we do work with contingencies. The situation changes every hour, every minute. Anytime there's an incident or there's even a rumor of an incident, we start preparing in terms of, okay, if this happens, what do we do? What do we do with our team? I mean, the safety of our team is paramount as well. We want to make sure that Tom and all of our colleagues, whether they're national staff or coming from the US or other parts of the world, their safety is our number one priority. So we look at different contingencies. For example, if there's an attack on the road, then we reduce the amount of people that go on the road. And this is where training of our local counterparts is critical. Because at the end of the day, our job is not to replace the Ukrainian health workers that are working in Lviv or in Kyiv, or the Romanian health workers. Our job is to empower them and give them the tools that they need to do the work themselves. And that helps us also with the contingencies in terms of how much are we needed beyond sending supplies and supporting them and training them. But I mean, we're looking at, the team that's in Ukraine, and with the war raging and going further west, what do we do with our team? Where do we evacuate them? What happens if, Lviv comes under attack? What happens if the supply roads also are cut off? So we're putting a lot of those contingencies in place to make sure, first of all, that people continue to be able to provide medical services even as the war rages on. We need to make sure that our team are safe, but also at the same time, the people that we serve, the patients that we serve, are also safe and getting the healthcare that they need, whether it's physical or psychological. And, crossing the border, I mean, this is something that all the countries are working on, whether it's Poland or Romania or Moldova or Hungary. They're working on what happens if this escalates. And we're part of the coordination mechanism with other organizations because one organization cannot do it alone. We're doing our part, and we're coordinating with others as well as with the host government to make sure that whatever comes, we can deal with it as much as possible. I mean, 1.5 million refugees, over 1.5 million refugees in 2 weeks. Who would have expected that? Yet we pivoted, we provided support, we're sending additional teams, we're sending additional supplies to try to cope with it as much as possible.
Well, we watch with just, awe and admiration the sheer bravery of clinicians who are choosing to stay in Ukraine, often sending their children and their families out of country because they're trying to stay and treat patients amid the bombings and the rocket fire. We had the honor of speaking to a clinician from a polyclinic on the show not long ago. And I think we will always remember her saying, we run, we hide. When we hear the alarms, we go back to work, we take care of our patients. And the commitment is extraordinary. But we know they're also running out of basic medicines and food and water and fuel. Are you able to actually get supplies into Ukraine, to the polyclinics in the neighborhoods where people are still living and desperately depending on those healthcare providers for help?
Believe it or not, yes, and it's not a very easy or simple. It's a pretty complex mechanism to get supplies into what is essentially a war zone. There's complexities by the availability of drivers, for example. Something that you might not think of. Men 18 to 60 can't leave the country, so we're having to work with the government directly, the Ukrainian government and the embassies and the host country governments to move things across the border. One of our key partnerships, and one of many, and I guess I should say as an aside, one of the ways that we're preparing some of these contingencies and one of the ways that we're making this as flexible as possible is by having as many pathways into Ukraine as possible. So we don't just get one road or one particular city. We're going to cover as many as we can and find every option and use them, because if any particular pathway gets closed, the supply chain doesn't end. We still can boost up by others. So one of our key partnerships is actually Children's Hospital in Lviv, and we're able to partner with a hospital in Krakow in Poland and move supplies from that hospital into the other hospital in Lviv that needs them desperately. These hospitals in places that aren't feeling direct impacts of the war, aren't actively shelled, are receiving patients from the other hospitals. And it's not just the war wounded. It's also people who need heart transplants. It's people with cancer, as I said before. It's the primary healthcare as well. So the supply chain is flowing, and it always needs to be more, because essentially the normal pathways that Ukraine gets its medicines have been cut off. So we're creating a system with as many branches as possible to get things in country.
Rabih, Tom was talking to you earlier about the sort of difficulty of providing direct, culturally appropriate support to families, but one of the force multipliers that have come out of the sort of COVID pandemic, if you will, has been telehealth interventions. Our own organization has been doing e-consults around the country for a long time, but talk to us a little bit about how telehealth has been leveraged by your organization, or how have you seen it scale up during this crisis?
Telehealth has become a critical component of what we do, right? We learned in the pandemic that if you can't reach people physically, you can reach them in other ways. I mean, the fact that we're having this conversation on Zoom is an example of what could be done. And we're exploring the same thing in Ukraine, because certain areas we might not be able to send trainers or additional doctors and nurses to work with them. But as long as they have connectivity, we can do it. We can continue to provide either the training component or even consultation with experts in the region, or even here in the US, as long as there's a common language or the use of translators. This is something that's becoming more, integrated into what we do rather than an afterthought, which what telehealth used to be in the past. Now it's become integrated into what we do. When we look at options, we look at the telehealth option as one of the critical components through which we can provide patient care, but also at the same time, we can provide advice and training to doctors and nurses on the ground. And those are some of the solutions that we look at in a situation like Ukraine. I mean, we don't know what roads are open today. We don't know, what city or town is going to have connectivity today or not. And telehealth helps us reach the patients, reach the providers without taking great risk and at a very reduced cost. I mean, it's much cheaper to do that than to do anything else. So it's become a component of what we do. And we're looking at different trainings that we could do based on demands from doctors and nurses in Ukraine. They said, can you help us with this? And we're looking at those components to see how we can do that from the US or from Poland or Romania, and making sure that they still get the quality care that they need, and they still get the quality support that they deserve as well. I mean, Margaret, you mentioned the Ukrainian doctors and nurses that are staying behind. I mean, we owe it to them. Those are heroes that are staying behind. They're risking their lives to save others. We owe that to them. We owe it to them to find every single solution that we can to support them. And this is one of them, definitely.
Well, Rabih and Tom, that is a great example of how people around the world can help. But we want to make sure we give you an opportunity because everybody watching this feels compelled to help in some way. volunteer, amassing medical supplies, other resources. Take a moment to tell the people viewing or listening to this, what's the best way for people to help in this cause right now? What do you need that people in the United States and around the country can do to help?
Project Hope, we're not just here for the acute phase of this. As Rabih said, we get there soon and we get there quickly. But we also recognize if the war ends right now, there are going to be years of work, not only in the host countries, but also to rebuild the health systems of Ukraine. So every ounce of support is absolutely needed. It is all hands on deck for a crisis of this size. People can visit us at projecthope.org. Follow us on our social media, see what we're up to. And right now, anything anybody can do to support is greatly needed. Thank you.
And Rabih, the Project Hope really has so many other humanitarian crises that it's also addressing. We're still in a pandemic. Many regions in the southern hemisphere still have no vaccines. There's ongoing refugee crisis in Syria and other hotspots. Just let our listeners know a little more about the scope of Project Hope. Obviously, the tip of the spear right now is focused in on the battles that are happening in Europe. But you also have a much broader agenda that you're focused in on as well.
The world didn't stop. The disease did not stop because of the war in Ukraine. People are still struggling all over the world. And for us at Project Hope, we're currently working in about 30 countries around the world, in Africa, in the Americas, in Asia, and in Europe. And we're focusing on different things. Infectious disease. I mean, we're still dealing with the pandemic, as I said, globally. And it's still raging in certain parts of the world. So this will continue to be one of our focus. Focusing on maternal and child health. I mean, the pandemic sent us back decades when it comes to maternal mortality and infant mortality. So we're putting a lot of focus on that as well to make sure that women and children don't die unnecessarily because of lack of medicine or because of lack of vaccine or because of lack of training. Looking at non-communicable diseases, I mean, one of the main issues that's coming out of Ukraine is diabetes, as Tom mentioned, cancer, is chronic disease that are not being treated. So non-communicable disease is something that we're still tackling globally as well. In addition to all the hotspots that we deal with around the world, whether that's what's going on in Venezuela and the region, or what's going on in certain parts of Africa, in Nigeria, or in Ethiopia, the war in Ethiopia as well. This is something that we continue to work in. And we have our teams all over the world that are providing those services. And we urge everybody to, as Tom said, go to projecthope.org, learn more about the organization, support us in whatever way you can. If you can donate, fantastic. If not, volunteer. Spread the word about the work that we're doing. And if we don't fall within what you're interested in, vet other organizations that you're interested in. The most important thing is for you to do something. Because the worst thing that we could do to Ukraine and to the world at large is to sit back and do nothing. And this is what we urge people, just do something to help. And if Project Hope, if you like what we do, that's fantastic. If not, we're grateful for whatever support you give to other organizations as well.
We've been speaking with Rabih Torbay, CEO of Project Hope, and Tom Cotter, Project Hope's Director of Emergency Response and Preparedness. Learn more about their efforts in the war in Ukraine and the refugee crisis by going to projecthope.org. And you can learn more about conversations on healthcare by going to chcradio.com. Rabih, Tom, thank you so much for your humanitarian efforts, for your leadership in this work, and for joining us today on Conversations on Healthcare.
Thanks for having us.
Thank you for having us.
Yeah, thank you so much
for what you're doing.
Oh my God. Yeah. All right. All our thoughts are with you all. Take care.
Thank you. Thank you for bringing up this issue and for talking about it, because the world needs to know what's going on. So we appreciate you.
Absolutely.
Absolutely.
Take care.
Bye-bye.